Have you ever experienced lightning eyes? A peculiar term, isn't it? Well, it's a real thing, and it's as severe as it sounds. Picture this: you're a welder, and one day a stray spark lands on your eye. That's a welding arc, and it can cause serious damage to your cornea. The aftermath of this can be mild to severe pain in the affected eye, or even both eyes. Not just that, you might also experience an increased sensitivity to light, bloodshot eyes, blurred vision, and watery eyes. There could also be a sense of irritation and the feeling that something is amiss in the eye. Now imagine the pain you feel when your eyes dry out and stick to your contact lens, tearing a small layer of corneal cells. That's the closest comparison to the pain of a welder's flash. And if the damage is prolonged, you may even need an eye prosthesis. UV rays are not just harmful to your skin, but also your eyes. These rays can cause eye damage and glare from sources like a welding torch, direct sunlight, solar eclipse, sun reflection on water or snow, thunder and lightning, sun lamps, and even other lamps such as halogen lamps, photographic flood lamps, and more. A condition like glaucoma requires careful care and treatment because it's extremely painful. Along with medical treatment, a few home remedies might help speed up recovery. However, it's crucial to remember that while these treatments may help reduce the symptoms of eye twitching, medical treatments, ointments, antibiotics, or dilating eye drops are essential for faster recovery. In summary, lightning eyes is a severe condition caused by UV rays, resulting in symptoms like pain, sensitivity to light, bloodshot eyes, and more. It's crucial to seek immediate treatment if you experience these symptoms, and even consider using an eye prosthesis if the damage is prolonged. Home remedies can help, but they're no substitute for proper medical treatment. So, if you've ever experienced lightning eyes, it's important to take it seriously and seek help immediately. Remember, your eyes are precious and they deserve the utmost care. Do you know what to do after an eye electrocution? The first and foremost home care after an eye electrocution is to know the best home remedies for eye twitching. Potatoes, for instance, have a cooling effect and are known to reduce inflammation around the affected eye. Simply peel and grate them, place the grated potato on a wet towel, wrap it up and refrigerate. After a few minutes, apply it on both eyes for a quarter of an hour. An ice pack is another useful remedy. If you have two, place them on both eyes for 5 minutes. Ever thought of using tea bags? Dip a tea bag in hot water, squeeze out the excess liquid, let it cool, and put it in the freezer for about 15 minutes. Cover both eyes with these tea bags for 10 to 15 minutes. Repeat this as necessary whenever you feel pain. Cucumber slices are also beneficial. They have a soothing effect due to their rich properties of water, vitamins, and minerals. Cut 2 thick slices, refrigerate for 10 minutes, and place them on the eyes for about the same amount of time. Depending on the severity of the symptoms, you can repeat this process up to 3 times a day. Another substance that acts as a cooling agent is banana pulp. It can easily reduce the pain and irritation of the affected eye, reducing the itching and inflammation significantly and providing much-needed relief from the discomfort of the irritated eye. Rose water can also help reduce the pain and burning of the affected eye. Prepare pure rose water without any additives, dip 2 cotton pieces into it, squeeze out the excess liquid, and place the cotton on each eye for 10 minutes. This process can be repeated 3 times a day for quick relief. Milk, believe it or not, can also be quite beneficial. The natural enzymes in milk are useful for healing damaged tissues and reducing inflammation of the eye. Dip 2 cotton balls in pasteurized milk, squeeze out the excess milk, refrigerate for 5 minutes, and then place the cool cotton on the eyes for 10 minutes. Repeat if necessary. Lastly, almond oil, rich in vitamin E, helps protect the membrane from UV rays and relieves burning, pain, itching, and discomfort in the affected eye. Pour enough almond oil in a cup, apply the oil on and under the eyelid with a clean finger, and leave it there until you feel a soothing effect. This process can be repeated twice a day. So there you have it. These home care remedies are very helpful in the recovery process after an eye electrocution. Remember, your eyes are precious. Take good care of them.
Did you know that a jolt of electricity can do more than just shock your system? It can also shock your sight. Today we delve into the riveting story of how an electrical injury can lead to unexpected and severe consequences for the eyes. Imagine for a moment the case of a young electrician named Michael. One ordinary day at work turned extraordinary when he accidentally came into contact with a live wire. The shock was immediate and intense. Within hours, Michael noticed that his eyesight wasn't quite the same. His pupils were uneven, a condition known as anisocoria, and his vision started to blur. This was just the beginning of a series of eye-related complications. As days turned into weeks, Michael developed acute bilateral iritis, an inflammation that affected both of his eyes, causing pain and further vision impairment. But the challenges didn't stop there. Over the next few months, he was diagnosed with bilateral cataracts, which clouded his vision even more, and macular cysts began to form, adding to his visual difficulties. The journey through diagnosis and treatment was long and fraught with uncertainty. Michael underwent multiple surgeries and a series of treatments to address each condition. Cataract surgery helped clear his vision, while specific anti-inflammatory medications were prescribed to manage the iritis. The macular cysts required careful observation and eventually more invasive procedures to prevent long-term damage to his retina. Electrically induced injuries like Michael's are rare, but highlight a critical aspect of ocular health. The electrical current, when it passes through the eyes, travels particularly through the retinal pigment epithelium cells. These cells absorb energy, and due to their high concentration of melanin, especially in the macula, produce significant heat. This not only leads to thermal damage, but can also result in various forms of macular degeneration, including holes, edema, and cysts. This case underscores the importance of not just immediate, but also ongoing medical attention after an electrical shock. Symptoms like cataract formation might appear gradually, making regular checkups crucial. Moreover, the potential for delayed ocular manifestations means that vigilance is necessary long after the initial injury. In conclusion, electrical injuries can have profound and lasting effects on ocular health, with potential for both immediate and delayed complications. Awareness and prompt treatment are key to managing these effects and safeguarding vision. Remember, the eyes are not only windows to the soul, but also indicators of well-being, deserving protection and care at all costs.